Paralysis is a condition that often arrives without warning, yet in reality the body usually gives silent signals long before movement is lost completely. Understanding these early signs can truly save a life because paralysis is not always sudden and irreversible. It is often the final result of problems that develop slowly inside the body, affecting the brain, spinal cord, nerves, muscles, or blood vessels. Many people believe paralysis only happens after a major accident or a severe stroke, but this belief is dangerous because it causes people to ignore early symptoms that could have been treated. Paralysis can affect one side of the body, both sides, the lower half, or even the entire body, depending on the cause and area involved. The most important thing to remember is that paralysis is not a disease itself, but a result of underlying health issues, and recognizing those warning signs early can prevent permanent damage. One of the earliest and most common warning signs is unusual weakness. This weakness may start in one arm, one leg, or even in the fingers. At first, it may feel like simple tiredness or lack of energy, and many people ignore it, thinking it will pass. However, this weakness often appears suddenly without heavy physical work and does not improve with rest. You may notice difficulty holding objects, trouble lifting your foot while walking, or a feeling that your hand does not respond the way it used to. This weakness can come and go, which makes it even more dangerous because people delay medical help when symptoms temporarily disappear. This kind of weakness can be an early sign of nerve damage, reduced blood supply to the brain, or spinal cord compression. Vision problems can also serve as an early indicator. Blurred vision, double vision, sudden loss of vision in one eye, or difficulty focusing are serious symptoms. The brain processes visual information, and any disruption in blood flow or nerve signals can affect sight. Vision problems accompanied by headache, weakness, or confusion can indicate a stroke or brain swelling, which may progress to paralysis if not managed promptly. Severe or unusual headaches should never be dismissed, especially if they are sudden and intense. A headache described as the worst of one's life can indicate brain bleeding or increased pressure inside the skull. Chronic headaches that gradually worsen over time may point to brain tumors, infections, or inflammation. These conditions can damage areas of the brain responsible for movement, leading to paralysis. When headaches are combined with vomiting, confusion, or weakness, immediate medical attention is essential. Facial drooping is a classic warning sign that many people recognize but still delay acting on. When one side of the face suddenly droops or the smile becomes uneven, it suggests facial nerve involvement or a stroke. Difficulty closing one eye, drooling, or changes in taste may also be present. Early treatment in such cases can prevent long-term paralysis of facial muscles and reduce the risk of further neurological damage. Did you know that some early signs of paralysis are often overlooked? Let's talk about a few that deserve your attention. First, difficulty swallowing. If you find yourself frequently choking, coughing while drinking, or feeling like food is stuck in your throat, it could be a sign of nerve or muscle issues. Swallowing is a complex process, and when the signals get disrupted, it might point to a neurological problem that could eventually lead to paralysis. Next, changes in bladder or bowel control. A sudden loss of control, trouble urinating, or unexplained constipation could signal a problem with your spinal cord. The spinal cord manages these functions, so any injury or inflammation can interfere with the signals. If this isn't addressed, it could lead to paralysis below the point of injury. Also, watch out for persistent muscle stiffness or spasms. If your muscles feel tight, painful, or hard to relax, or if you experience involuntary jerking movements, it could indicate nerve damage or a brain disorder. This kind of stiffness, especially if it gets worse over time, should always be checked by a doctor. Finally, extreme and unexplained fatigue. We all get tired, but if you're suddenly hit with severe exhaustion without any real reason, especially if it comes with weakness, numbness, or vision problems, it's a serious red flag that could precede paralysis. If you notice any of these symptoms, please don't ignore them. Talk to a healthcare professional right away. Early detection can make a huge difference. Thanks for watching, and take care. One of the most dangerous mistakes people make is ignoring these early signs due to fear, denial, or lack of awareness. Many people hope symptoms will resolve on their own or rely on home remedies without proper diagnosis. This delay can result in irreversible nerve damage. Early medical intervention can often stop progression, reduce inflammation, restore blood flow, or relieve pressure on nerves, thereby preventing permanent paralysis. The causes of paralysis are diverse, and understanding them helps in recognizing risk factors. Stroke is the most common cause and occurs when blood flow to the brain is interrupted by a clot or bleeding. High blood pressure, diabetes, high cholesterol, smoking, obesity, and lack of physical activity significantly increase stroke risk. Early signs of stroke often include weakness, numbness, speech difficulty, and facial drooping. Quick treatment within the golden hours can save brain tissue and prevent paralysis. Spinal cord injuries are another major cause. These can result from accidents, falls, infections, tumors, or degenerative diseases. Early symptoms may include back pain, weakness, numbness, or changes in bladder control. Prompt diagnosis and treatment can prevent worsening damage. Prevention of paralysis begins with awareness and lifestyle changes. Managing blood pressure, blood sugar, and cholesterol levels reduces stroke risk. Regular physical activity improves blood circulation, strengthens muscles, and maintains nerve health. Avoiding smoking and excessive alcohol consumption protects blood vessels and nerves. A balanced diet rich in vitamins, minerals, and antioxidants supports nervous system function. Recognizing early warning signs and seeking immediate medical care is the most powerful tool in preventing paralysis. Time is critical, especially in conditions like stroke and spinal cord compression. Emergency treatment can restore blood flow, reduce swelling, and protect nerve cells. Rehabilitation, including physical therapy, occupational therapy, and speech therapy, plays a vital role in recovery and improving quality of life. Paralysis does not only affect the body, it also impacts mental health, emotional well-being, and social life. Fear, anxiety, depression, and loss of independence are common. Early intervention and support from healthcare providers, family, and community can make a significant difference. Education empowers individuals to take control of their health and respond quickly to warning signs. Many cases of paralysis are preventable or reversible when caught early. The body often whispers before it screams. Listening to those whispers can save a life, preserve independence, and prevent lifelong disability. Ignoring early signs is a risk no one should take. Awareness, timely action, and proper medical care are the keys to protecting the nervous system and maintaining mobility. Paralysis is not always a sudden fate, but often a preventable outcome when warning signs are understood and respected. Like, share, and subscribe for more update.